All right. Well, thanks again for joining. My name is Carrie Frank. I am the Vice President of Communication and Marketing, and we are excited to talk about some funding today that's available to access the Colorado All-Payer Claims Database services, as well as some new evaluation services and other things that you can access on behalf of CIVHC's products and services. I'm joined today by Pete and Liz. They are my colleagues. Liz is the VP of Research Partnerships and Innovation. We call that RPI. And Pete is the VP of Client Solutions and State Initiatives. I'm saying it should be state. I see that there's a little bit of an error, but we call that team the CSSI team. So we're really excited to have them today. Our agenda is to just give you a brief little overview of CIVHC if you are just joining one of our webinars for the first time and maybe you're not familiar with who we are. We're talking about two very exciting funds that we have. One is the APCD Scholarship Fund and one is the new Health Equity Fund. We'll also talk about some new discounted pricing structures that we have in place, and then we'll have time for plenty of Q&A. So housekeeping items, just so you know, all lines are muted right now. We would love to hear from you though, so please use the chat box to ask questions. Feel free to pop in questions at any point in time. We will have a formal Q&A towards the end. But if you don't want to forget a question that you have, feel free to go ahead and pop it in the chat box. We are recording this webinar, and the slides and a link to the recording will be posted on the events resources page at civhc.org after the event. So quickly about who we are. CIVHC is a nonprofit organization. Our mission is to equip partners and communities in Colorado and across the nation with resources, services, and unbiased data. And all of that is to improve health and healthcare. Our vision is so that everyone will have the opportunity to be healthy and has access to equitable, affordable, high-quality healthcare. As I mentioned, we're a nonprofit organization, and we really pride ourselves on being independent and objective, and we are very service-oriented and focused. So we serve a variety of folks across the healthcare landscape, all with the patients and consumers in the middle. We call everybody who's working to improve healthcare a change agent. So those are individuals, communities, or organizations that are all working to make Coloradans healthier and improve their lives and lower the healthcare costs. So we work with clinicians, hospitals, employers, government agencies, researchers, health plans, nonprofits. And again, some of the programs and things that we're going to be talking about today are really to help expand access and to support for those who we serve. We serve as the administrator of the Colorado All-Payer Claims Database, and through that work, we make public APCD data available, as well as non-public data. The programs that we're going to be talking about today are funding to support accessing non-public information and our other CIVHC support services, which include program evaluation, research, analytics services. We also do healthcare programs across palliative care, advanced care planning, older adults, and do some community engagement work as well. So I'm going to go ahead and turn it over first off to Pete Sheehan, again, with Client Solutions and State Initiatives, and he's going to talk to you about the scholarship program. Go ahead, Pete.
Thanks, Carrie. Thank you for having me here today, and thank you to our webinar participants for their interest in data from CIVHC and the Colorado APCD. The Colorado APCD Scholarship Program benefits a number of different types of organizations seeking to access data through the data warehouse that we administer on behalf of the state of Colorado. We go to the next slide. There's a pool of $500,000 made available through the generosity of the Colorado General Assembly to offset the cost of licensing data, to go ahead and access data out of the warehouse and several of the other services that CIVHC provides. And this is an annual part of the state budget process, and provided they continue to fund the program, the funds will be available to benefit the organizations that may not have the funds or resources otherwise to access the data. Let's go to the next slide. Scholarship funding is available for eligible organizations, which include nonprofits with annual revenue of $10 million or less, as reflected in their most recent 990 filing with the IRS. Government entities are also available, and those range from local and county governments, state government agencies, and the federal government. This includes state-supported institutions of higher education and affiliated researchers. Private colleges and universities are not eligible, however, as they are not considered governmental entities. Along the right-hand side, we've provided a few examples of the types of projects that are eligible for funding. There are many different projects. This is not an all-inclusive list. This is just provided as an example, looking at researching and implementing new ways to design benefits, understanding variations in cost and quality, utilization patterns, and many other types of projects. Let's go to the next slide. In general, the fees for both custom reports and data sets have a broad range from about $20,000 on the low end to more than $100,000. This is impacted by some of the variables that people request when requesting data from us. And they include, are you looking for a de-identified data set? That's kind of our most or least sophisticated data set that many people use without identifiable health information. We also have what we call limited data sets that include a limited set of PHI information, like dates of service. And then we have fully identifiable data sets that a lot of the researchers access. The fully identifiable data sets are our most expensive types of data sets. The other variables that come into how cost is calculated or how fees are calculated include the number of years of data requested, the different business lines that are requested, whether you're asking for commercial data, Medicaid data, Medicare data, or all of it combined into one. Just as a note for our participants today, Medicare Advantage data is included in our commercial data business line. Costs are also impacted by whether or not a data requester is providing a file to match against for a population, what we call a finder file, or if they're asking for some of the value-added features that we have, such as geocoding or some special filtering. We're going to talk about this later in the presentation, but we have this new tiered pricing framework or discount framework that also impacts the final price or the cost of licensing data from us. So we'll get into more detail on that towards the tail end of this presentation. Next slide. Some things to note about the scholarship program. There's a cap of awards of $50,000 per project. So no more than $50,000 can be awarded to any one project. For out-of-state projects, there's a cap of $50,000 for all projects. So let's just say we have 3 out-of-state projects that receive awards. Those 3 projects in total can't be more than $50,000 together. And then there's also a set aside for legislative projects. There's a lot of policy issues that access our data, or people researching policy issues that access the data. And we set aside 10% of the funds annually to help cover the costs and fees associated with those requests. Next slide. This grid represents the different ways or different percentages that can be covered by the scholarship program, depending on the type of organization that is requesting the award or putting the application in. Nonprofits can have as much as 85% of their project costs covered by the scholarship fund. Generally, it's about 80%, but if you have annual revenue of less than $5 million, it can be up to 85%. Colorado-based government entities can have 80% of their costs covered by the program. Federal and out-of-state government entities are eligible to have 25% of the project costs covered, and out-of-state researchers and affiliated with public institutions of higher ed are eligible to have 50% of the costs covered. If you're in-state in Colorado, you're eligible to have 80% of the costs covered for in-state researchers affiliated with in-state education institutions. Please note that on the right-hand side, there is a column for requester responsibility. The intent of this program is to subsidize access to the data, but there's also an expectation that the data requester pays for a portion of the funds as well. Next slide. We wanted to share a little bit about the process. Uh, a lot of this happens behind the scenes, but you go through the normal process of putting in an application to request data or get a project going through representatives of the Client Solutions and State Initiatives team or the Research Partnership and Innovation team that Liz oversees. Or you can send an email to the Colorado APCD at civic.org, and we'll move the request forward and put it in the hands of the right people behind the scenes. So you start the process that way, and then we'll work with you to see if you're an eligible organization. And again, those eligibility requirements are listed there. And if you're eligible, we'll go ahead and start working on a scholarship request application behind the scenes. More information about everything related to the scholarship program can be found at the link or website listed at the bottom of the screen. Let's go to the next slide. This is what the actual scholarship application looks like. This is provided to the reviewers of the application, in addition to all the elements that go into a data request to access data out of the APCD. The APCD data request is a much bigger document that you fill out that includes project purpose, benefit to Colorado, what type of data you're looking for. And this application form that's right here is something that we layer on top of that. We fill it out on your behalf when there's an eligible organization with an eligible project that wants to request scholarship funding. And then we take all that information, we put it all together, and we send it off to the right folks for review and approval. Let's go to the next slide. So how does that actually work? There's a multi-step process to have these scholarship applications reviewed. But we want to talk about the two biggest steps for this group to be aware of. The first step is we put together the application, we send everything in, and we do that to a small group of people that are part of our APCD advisory committee. We call them our scholarship subcommittee. And the list of those people that are currently on the subcommittee are up on the top of the screen. We fill out that application and package everything and send it to them. And then they review the application. Sometimes it's approved right away. Sometimes there are questions. Sometimes there's feedback. And we manage that and funnel it all back to the requesters if there are questions and feedback. If and when the application is approved, we then send it off to the other second major step of the process, which is to the Department of Healthcare Policy and Financing, who is the administrator of the funds. They are the final review step, and if approved by them, then we'll let you know that it's approved, and we'll be communicating with you in terms of how much, and we'll start the project going. Next slide. We're going to just provide a short summary of the types of projects that went through the process this year. And so again, there's $500,000 available each fiscal year. That aligns with the state fiscal year, and so that number resets July 1st of each year. So for the current fiscal year, which ends June 30th, 25 projects were approved, totaling about 99.6% of the overall funds, $498,000. Compared to last year we had $427,000 allocated, so the fund usage went up 16.5%. Last year we had 22 projects. This year we had 25 projects. And then the average award per project went up about 2.5% to $19,000. So you can see just kind of the breakdown in numbers there. Let's go to the next slide. We track the awards into three major buckets, whether it was an academic or research request, a state agency or government entity request, or a nonprofit request. You can see the breakdown of where the funds went this year: 40% to the academic side, 33% to government entities, and 27% to nonprofits. And then we also had about $34,000 allocated to out-of-state projects, and just under the 50,000 set aside for legislative projects. Next slide. We thought it might be helpful as a reference point only to share the full list of projects approved, just to provide a flavor of what types of projects are eligible and receive awards. I won't go into the details, but just wanted to call out a couple of things. In the academic space, we had a researcher looking into the pediatric ED visits for dental conditions. That's kind of the second row up there close to the top. We jump down to the government entity area. The governor's office here in Colorado had a project focused on long COVID surveillance. Again, just as examples, we'll make the slides available, and then you'll have a full list of everything that was funded this year as a reference. Let's go to the next slide. In the nonprofit space, we had an employer group in Southwest Colorado, Local First, that used some of the data to better understand where patients in their community were receiving care in an attempt to better understand costs and utilization trends and how to address those to better serve their community. It's that second one at the top here, Local First. Again, just going to give you a flavor of the types of projects that were funded this year. We've got two other use cases we just wanted to share a little bit about. Here on this one, an epidemiologist from the Colorado Department of Public Health and Environment, Hannah Peterson, led a project seeking to understand what services are being utilized by older adults, specifically related to Alzheimer's, and some additional information from her in terms of accessing the data from the Colorado APCD. Let's go to the next slide. And Dan Sachs, associate professor from the University of Wisconsin, he received an award to research how changing insurance rules affect coverage and the impact of those changes to the market, including the special enrollment periods that occurred during COVID. Again, just wanted to give you a flavor of how the data can be used. We seek every year to fully allocate all $500,000. It's kind of a use it or lose it program. If we don't use all the funds, they go back to the general fund coffers at the end of the year. And so we're very excited this year to have come just a smidgen away from allocating the full $500,000. And we look forward to working with all of you if you have an interest and you work for an eligible organization and a request to go into the scholarship fund for the upcoming fiscal year or in future years. Again, we want to see all of these dollars get utilized. That's all I've got on the scholarship fund. And I will turn it over to my colleague, Liz Mooney, who is going to talk about a newer fund, the Health Equity Fund, and provide details on that.
Thanks, Pete. And thanks everyone for joining and for the opportunity to connect with all of you today. So I'm here to talk about, as Pete mentioned, a newer funding related opportunity to access Colorado APCD data and or CIVHC data research and evaluation services. And you can go to the next slide, please. Thank you. This fund is really very new, and it comes to us via a partnership with the Colorado Health Foundation. And its goal is really to focus on increasing community access to Colorado APCD data and CIVHC's newer research and evaluation services. So the target audience for this, the Health Equity Fund, is really community-based nonprofit organizations. As you'll see as we go throughout my portion of the talk today, there's a lot of areas where the Health Equity Fund is similar to scholarship, and there's also some key differences. We really view these funding opportunities as complementary. And I think I can speak for Pete, like both he and I and our respective teams are here to serve as a resource for you. If after hearing this presentation, you're interested in availing yourself of one or the other, but you're not sure what the right fit is based on the type of organization you are, the type of research project you have, we're definitely there to help you figure out what the right thing is for you and your organization. So with that being said, as I mentioned, this is a partnership with the Colorado Health Foundation. They have made $1 million available to Civic for this program to really extend the reach of the Colorado APCD data and research and evaluation services to community-based nonprofit organizations. We have internally decided to try to think about allocating that at around $250,000 a year over 4 years to sort of extend the time frame and the reach of the project in the fund. And like not just similar to scholarship, the purpose of the fund is to offset Civic's costs for research and evaluation projects and access to community Colorado APCD data for community-based organizations. It is not a check to a nonprofit organization. It is to offset the cost of civic services in helping those organizations with key research and evaluation questions they might have. Like scholarship, our maximum award is $50,000. Next slide, please. So I wanted to provide an example of a project that we did several years ago, which is really kind of our North Star when we think about the Health Equity Fund. The project was for Project Angel Heart, which, if you're not familiar with their work, provides customized home delivered meals free of charge for patients who are ill with chronic conditions, cancer, things of that nature. Using claims data, we were able to examine the healthcare costs of clients and patients who prior to, during, and after meal delivery service and compare that to a control group, and really were able to demonstrate the value of the program via a significant reduction in a hospital readmission, reduced in costs related to inpatient stays, and overall reduction of costs. So Project Angel Heart was then able to take that information and find other funding streams to support their work, because they had some quantifiable hard data to support the effectiveness and efficacy of their program. So like that concept and that model is really what's behind the Health Equity Fund. Not every project will be exactly that, but that's sort of like the impetus and really like the driving impact our team wants to have for organizations in the community. Next slide, please. So this slide, I will say the definition of health equity, and I should back up. The program is for community-based nonprofit organizations, and the project must be focused on health equity. So those are the two sort of conditions for eligibility for the Health Equity Fund. But that being said, I think that the definition of health equity, as we've defined it in partnership with the Colorado Health Foundation, is very broad. And I won't read this slide to you, but you can see that there are any number of project areas that I think address health equity that we've identified. There are probably others that are missing from this slide. We're also targeting very specific communities too, working a lot with tribes, other BIPOC-led organizations, older adults, children and youth, individuals with disabilities, or urban and rural, which I know is not listed, but that's an important difference as well. I'm always fearful when showing a slide like this that I've omitted something, and I'm sure I have here. But the point is that the definition of health equity is very broad and really is, the purview of the organization who brings a project to us for Health Equity Fund support. Next slide, please. Pete talked a bit about the process for scholarship. There's lots of similarities with the process for the Health Equity Fund. Really, the process starts with an organization reaching out to us, asking for more information, sharing that information, and working with the organization to understand, number one, are they eligible based on being a community-based nonprofit and working on health equity? But then two, what services do they need? Do they need just Colorado APCD data? Do they need that APCD data combined with other data to prove a value proposition, as an example? So that would require some additional services as well. Really would try to work with the organization to figure out that scope. And then when we have a scope that's defined and, filled out into a form, it goes through a health equity fund review committee, which is really comprised of organizations or individuals who work both at Civic and the Health Foundation. I'll also note that we are recruiting an individual who's working in community and health equity issues, but who is not affiliated with the Health Foundation or Civic to be part of this review committee. So that's a gap in our review process that we're trying to fill. Next slide, please. So I wanted to give a few examples of how health equity is complementary and then also but different than scholarship. As I mentioned, Health Equity Fund is really focused on nonprofit organizations and who are working on health equity. Another difference is that we're not tied to the fiscal year. So that $250,000 we allocate per year is a soft target and it kind of rolls. So there's no, if you're interested, but look at the calendar and think, oh my goodness, I have 10 days before the end of this fiscal year, like that's okay. We can start working with you, now and deliver a project later on. So it's not tied to the fiscal year in the same way that scholarship and other programs might be. One other rule that we have is that if you have a multi-year project, which several of our longer-term research and evaluation projects are longer term. Sorry about that. Are longer-term projects, and recipients can really only avail themselves of Health Equity Fund dollars or scholarship dollars in a given year. So in that regard, we do look at the calendar because it's really important, I think, for both programs to really extend the reach and make sure we're supporting as many organizations in Colorado as possible and for scholarship out of state. So I thought an example might be useful to sort of illustrate like how this looks. We have a project that we're working on with the Colorado Food Cluster, which is a program in Aurora focused on food security. So the first phase of that project is supported with a Health Equity Fund. And that's really looking at the program and some resources that are being offered by local supermarkets and using the supermarket data and who's availing themselves from a consumer perspective of the program at the supermarket, and really like looking at that market data, what food is being purchased, and the program offsets the cost of food for the participants. So what food items they are getting for free or a discounted rate. And then the second phase of the project will really focus on how the impact of having some support for wholesome, culturally appropriate food for this population affects health outcomes. Does it reduce unexpected ER visits? Does it allow for more appropriate venues for chronic care management, things of that nature? So that will require Colorado APCD data and will be a second part of the project. And at that point, we expect to go to scholarship to avail ourselves of, or CFC to avail itself of the APCD data it needs to do that second phase with the discounted prices that are available via scholarship. Next slide. So as I mentioned, we've just gotten started with the Health Equity Fund. We did a soft launch of this program in February with some projects that we were already working on, and then have started doing marketing and have updated our website to include information about the Health Equity Fund starting in mid-May and culminating with this webinar today. So many thanks to Carrie and her team for all the support there. We've had 3 projects approved to date, and as you can see from this list, they're, again, a wide variety of projects. One is for the Colorado Food Cluster project I mentioned. One is in partnership with Denver Indian Health and Family Services in a program they work with CDPHE on. and the other is related to school-based health centers with Youth Healthcare Alliance. We have our review committee meets monthly, and so we have two other projects that are being considered this week. One of them is related for the Denver Indian Health Center, and the other is related to housing for the Colorado Village Collaborative, which provides housing services to transitional homeless services to the unhoused population in and around Denver. So as I mentioned earlier, all of this starts with a contact to us at Civic to see if this program is the right fit for you. So you can feel free to send an email to equityfund@civic.org to ask some questions or get more information or to start the conversation. We'd love to chat more and learn more about your organization and how we can leverage the Health Equity Fund to support you. And that is my last slide. So I'm going to turn it back to Pete to talk about the tiered pricing and discount model.
Thanks, Liz. It was great to hear more about the Equity Fund. It's a wonderful program. We're so thankful for the partnership with the Colorado Health Foundation. And I'd be remiss if I didn't thank our wonderful partners at the Department of Healthcare Policy and Financing, who are the administrators of the Scholarship Fund. They make a lot of things happen behind the scenes, and wanted to provide a huge shout out to two people. Jerry Ware, who's the person we work with on the scholarship side at HCPF. He's just a wonderful person to work with. And Hannah Winning on my team at Civic, who manages the program on the Civic side. We couldn't have that program without those two individuals, so thank you both. On to a discussion of tiered pricing in a new framework for data licensing pricing and data licensing fees that we are implementing. Let's go to the next slide. Tiered pricing is part of Civic's ongoing effort to improve our financial sustainability and adjust our licensing fee model, including offering discounts to many of our partners. We've been the administrator of the Colorado APCD for 11 years, and other than some annual adjustments to our hourly rate, we haven't had any major changes to our pricing model in the last 5 years or so. When looking at kind of a market analysis, we've learned that our prices have fallen behind the current market rate for access to similar data and services from other APCDs and even other data warehouses that are out there providing similar types of data. As I just mentioned, we did conduct a market analysis to see what other models were in place, how other companies are actually managing their fee schedules, and how they license information out into the community. And we've learned that tiered prices or tiered models in different forms are used by many other organizations. Sometimes they're called scalable models. It kind of depends on the exact different type, but the tiered pricing model was recommended by a team at the University of Denver who evaluated our current client base and our existing prices. And what we learned through our own research is that it's out there in many forms with our peer APCDs, and we wanted to put something like that in place. We also looked at our costs and our hourly rates using the tiered model. And one of the things that we did is we held our hourly rates constant for community-based nonprofits. And so we'll talk more about that in a second. Let's go to the next slide. We have updated our fee structure to bring it on par with other APCDs, and we'll kind of dive into a discussion of this, what we call a 5-tier pricing framework that provides access to data in an equitable manner. This new model allows organizations that have greater resources to pay the market rate fees or our standard pricing or base pricing, and smaller organizations such as small nonprofits, students, legislators, and local governments receive a discount on fees. There's the discount component of this portion of the presentation. And we want to provide more transparency in that. Let's go to the next slide. Within this new model, we built a framework that's based on who large buckets or categories of who our major data requesters are. And we've broken those down into what you see here on the screen. So commercial entities are for-profit and private sector entities seeking to use the data to further a business objective or create a tool or product that will generate revenue to support business needs. So they're in kind of what we call tier one, and we'll show you the tier breakout on the next slide. They are actually receiving our base price or standard pricing. And then we've got discounts or discount levels in place for nonprofit organizations, Colorado-based institutions of higher education and affiliated faculty or researchers. We have a separate category for out-of-state institutions of higher education and their affiliated researchers, and then a student category. Let's go to the next slide. So how does this actually work and what does it look like? So you can see the data requester categories I just mentioned are referenced across the top here. Based on their annual revenue or whether they're in Colorado or out of state, they fall into one of those 5 tiers, which is along the far left column. The largest national and international for-profit companies, as I just mentioned, pharmaceutical manufacturers, big data companies, companies that have more than $100 million in annual revenue fall into that tier 1, that top layer. And then we go kind of down that tier axis on the left side to tier 2 through 5. And so all other tiers will receive a discount. Those discounts do vary. What we have in that second column here is an average discount. The discount any individual project or organization will receive is really subject to their specific project. But when we modeled everything out, we did a comparison analysis to almost 50 projects that we produced this year. And on average, the organizations and types of projects that fall into tier 2 will receive about a 16% discount. And those include mid-sized commercial entities, larger nonprofits with revenue of more than $100 million, federal government, and out-of-state researchers. Tier 3 organizations or projects will receive on average about a 25% discount, and those include smaller for-profit entities, mid-sized nonprofits, government entities that are outside of Colorado, but not as big as the federal government, and Colorado academic institutions. We do a lot of projects with academic institutions in Colorado, and they will fall right in that middle category in tier 3 and receive on average about a 25% discount. The tier 4 organizations will receive about a 34% discount on average. Those include smaller nonprofits or kind of the small to mid-sized nonprofits with revenue between $5 to $20 million and the Colorado state government. And then in tier 5, the tier 5 organizations will receive on average about a 47% discount, and those are nonprofits with less than $5 million in annual revenue, county and local governments, and then students. Students, regardless of their affiliation, in-state or out-of-state, will receive the lowest price. And that's about a 47% discount. And then, as we mentioned throughout this presentation, through Liz's discussion on the Health Equity Fund and the scholarship program, we have those other programs in place to help subsidize the funding even further for organizations that have less than $10 million, or if you're a small community-based nonprofit, you may be eligible for one of those programs as well. And we've got some of the additional details about that across that bottom row. But in general, we think this is a great new way of looking at things where it's a fair way and equitable way to provide costs and discounts with again, the larger organizations that can afford to pay more, paying more, and the smaller organizations that don't have those types of resources pay less. Let's go to the next slide. And just to summarize, that new 5-tier pricing or discount program, we are adjusting our fees to be on par with the market rates that we found in our research. We are implementing this model. It is an equitable model, we believe. Again, so those who pay more do, and those who have less resources pay less. We will continue to focus on providing high quality and high value services across the board for for all the types of projects. And this model also contributes to our long-term sustainability. And we're going to be reviewing how this works and how it plays out on an ongoing basis and making adjustments and tweaks as needed as we learn more about this as it goes into implementation. That's all I've got on that. I think that kind of wraps up that portion of the program, and I will hand it back over to Carrie.
Thank you. Thanks, Pete and Liz, for doing such a great job of going over both of our programs and new funding and exciting stuff going on and discounts, everything that we're doing. We're so excited to be able to expand access to the data and services that we can offer. So I want to open it up. I don't think we have anything currently in the chat box. I did put those email addresses. You have Pete and Liz's email right here on the screen, but if you do want to reach out regarding, excuse me, the scholarship, it's in the chat box. It's Colorado APCD at civic.org, and the Health Equity Fund is equityfund@civic.org that you can contact directly. If you're not sure which one you might qualify for or which one would be best for your program, you can feel free to reach out to both email addresses or reach out directly to Pete or Liz, and they can connect you with the right folks to have those discussions. So I don't see anything else in the chat box at the moment, and I want to be cognizant of time. I know everybody's busy these days, and we're excited that you guys joined us. Again, all of these, the recording and the slides will all be available after the fact, so stay tuned to our website, or you can reach out to any of us and access any of the information that we just presented today. So thank you everyone for joining today, and I hope you all have a great rest of your day. Bye-bye.